if I traded it all, if I gave
So welcome back.
all away
Welcome back, everyone. We are live on Facebook, so I want to say hi to everybody out there. Like us and follow us, and I'm going to be sharing the show afterwards. My next guest, this is going to be pretty interesting, everybody. I have with me Michelle Roy, and she's a physician assistant with Phusion Wellness. Welcome to the show. It was a wellness show today. Tell everybody a little bit about yourself and what you do.
I'm a physician assistant. I'm currently working for a chronic pain management practice. We manage chronic opioid therapy and coordinate care with patients for their chronic pain.
Well, let's talk a little bit about that. That's a fast thing to say, but it's so important for people to understand, first of all, the importance of, where people that are using opioids, where that fits in, right, to patients, and how you've made it, not only can they come into your office, but you can even work with them telemedically as well.
Correct. Yes. So patients can either be seen in the office or they can be seen via telemedicine. So that allows our services to go pretty much throughout the state. Patients have to come in the office for their first visit, just so we can establish care with them, the doctor-patient relationship. We're actually working on taking that mobile as well, so we can come to the patient. So patients that maybe have a long drive with chronic pain, that's the last thing you want to be doing is getting in the car for 3 hours to come and see us. So we're trying to make that more available to them where we can establish that relationship over distance, I guess.
Sure, absolutely. Now, give us some of the different things that you work with people. They are addicted, they are not. What are their issues that you're dealing with?
So we manage chronic opioid therapy. That's our main, focus in our practice. So chronic pain patients who have exhausted all their other possibilities. They've gotten their injections, they've had surgery, they've done physical therapy. And in order to have quality of life, they are on chronic opiates to, be able to get out of bed, to go to work, to take care of their family. We've since added some services. Those services include addiction. Taking opioids sometimes comes with that risk. There are people that abuse opioids. So it's important that we incorporate that into our practice. We do prescribe Suboxone. Suboxone is a medication for people who are trying to get off opiates, whether that's illicit opiates like heroin or their actual prescription opiates.
Mm-hmm.
We've since added some behavioral health to our practice. So we have a therapist. We're going to start some group sessions. Chronic pain comes with issues, depression, things of that nature that people need to deal with. So we're trying to take care of the whole patient.
Right. So that's awesome. So your offices are located in Mesa, but you can help anyone from anywhere. You're doing these
anywhere in the state of Arizona.
Anywhere
correct.
in the state of Arizona, they're telemedicine. That's the new thing right now, I guess. But that's awesome that you can, especially if you are in a chronic pain issue. You can't get up out of bed. That's really hard to get and then have to drive somewhere. You do free phone consultations with your patients.
So we have a screening process when someone calls in. Not everyone needs a consultation with us. There's just some few exceptions. Either the patient wants to make sure that, we're a right fit for them. Maybe they've kind of been jaded a little bit by one of their previous providers. They're on a high dose. They're wondering if, we're going to be willing to help them with that. And then we also want to make sure we're a right fit for the patient. There are patients on high doses or that are on other medications that are a little bit more riskier, and we just want to make sure we have an upfront conversation with that patient of what to expect when they show up at the office.
I also want to make sure that I'm clear when we're talking here too. So let's say someone's listening and they have somebody who is addicted, let's say, to taking the medication. Can they come to you?
Absolutely.
Okay, so it could be that you're just addicted. It could be that you are in pain and you've gone the furthest route, and they can come to you and you can help them, and you can, prescribe that then and help them make sure that they don't get addicted. Is that correct?
So we are geared toward the patient who's already on opioid therapy.
Okay.
Okay. But we're not going to, I'm not going to say we're not good. We're geared to the patient that's already on opioid therapy.
Mm-hmm.
So we're continuing care.
Okay.
They've been on their opiates for however many years or.
Go ahead.
Oh, sorry. They've been on their opiates for however many years and need somebody to manage that. They need to manage their monitoring. They need to manage their dose. They need to
Does anybody not do it? Does anybody ever, like, do you ever wean them off where they're no longer, where they're, or does that pain usually stay in and they're on that and that's something that you just keep on going on forever? How does it work?
So chronic pain doesn't go away, degenerative disc disease, failed spinal surgery, things of that nature. We have some patients who have rheumatoid arthritis. We have patients who have lupus. Maybe they have degenerative disc disease in their neck. We have patients who have diabetic neuropathy. Those conditions aren't going to go away. So they are going to be on chronic opioid therapy.
And they can call you and they can talk to you and you can help them along with that therapy.
Correct.
Now, your phone number to call, it's 480-559-3149.
Yes.
Your website is Phusion Wellness, and that's with the PH. So phusionwellness.com. They're located in Mesa, but they do also do free phone consultations and telemedicine, so they're statewide for everybody out there. So why are you extending your practice to the, to this opioid people?
So I just think it's important to take care of the whole, we think it's important to take care of the whole patient. I think it's important that they get the behavioral health they need and they get the counseling that they need. A lot of
I think it's wonderful that you are doing that and that you think that way, because a lot of people don't think that doctors do, right?
Mm-hmm.
They think that it's just, well, we're going to write that script out, and here you go, and you'll feel much better.
Right.
And then they do, and they do, and they do, and they do. But what you're doing is, there is a place for it, is what you're saying, but we're going to make sure that we are taking care of you in the right way.
Correct. So we're offering Suboxone therapy, specifically I had a patient maybe like 2 months ago who came to me. He was on heroin, and his family brought him into the office, and you kind of have to get those people right in that moment when they're ready to, get off of their opiate, and I put him on Suboxone, and you start slow and then you see him back, and I've been seeing him now about 3 months, and he's got a really good support system and he's doing really, really well.
Well, let's say someone's listening to this and they have a loved one that they maybe think might be addicted. Can they call you?
Yes, absolutely.
Okay. Because that, that to me is where I love that, because I don't mean that what I mean by that is that there's so many people out there that we have people in our families that can you help them? Like, they don't even know what to do. Can you help the person that might be listening to this that might have somebody in their family that is just in that situation, and can they call you and talk to you and say, what do I do? I want my son to come to you. Can it start with that?
Typically, we ask the patient to make an appointment, and then we want to speak to the patient directly. We certainly have staff that would be happy to explain to that family member what we do and what our process is and our intake process for the patient. Mm-hmm. Absolutely.
Right. I mean, obviously the patient has to want to come in,
Correct.
But they might want to talk to you and say, how do I talk to my, because I know it sounds like you can help them. And so, or the person, whoever it is, and now they can talk to you and maybe get a little bit of information and go to them and then talk to the patient, their loved one, and have them make that appointment with you.
Correct.
Okay.
And that's the same for the chronic pain patient that's at home too, or maybe the family
Right. You
member.
don't have to be addicted to anything.
No, we treat chronic pain patients, and we want patients to know that we are here to treat them with compassion. This is a sticky subject, so to speak. People feel stigmatized, and they feel, that
right.
This is a crutch,
right.
And a burden to bear to have to be on these medications, and it shouldn't be.
It shouldn't be. And sometimes it just is, right?
Mm-hmm.
I mean, it is, and we know that. And I know people that are in terrible pain, and when you're in pain, it's the worst. And people they don't have to live with it, or they can get some therapy through you. And you know what? Sometimes you just have to be on that type of medication that if it makes your life better, then you should be.
Mm-hmm. And I think it's important to say that we are willing to treat the difficult patient, the patient on that higher dose of opiate that maybe is struggling to find a provider, or is maybe not comfortable at their current provider because their provider wants to lower their dose of opiates, let's say. Now, that's not to say that we're going to maintain someone on a high dose of opiates by any means, but we're willing to have that conversation and treat that patient with compassion.
Check them out on the website. It's Phusion, PH, with the PH, phusionwellness.com. It's 480-559-3149. They do free phone consultations. They're telemedicine, so they can help anyone in this state.
if I traded it all.
So welcome back, everyone. We're talking with Michelle Roy, and she is a physician assistant with Phusion Wellness. Difficult patients that are dealing with pain, terrible chronic pain. I want to talk a little bit about what the hardest challenge, the most challenging about your treatment with chronic pain patients is.
I think the most challenging thing is finding that balance between compassion for the patient and following the rules that we need to follow when we're prescribing chronic opioids. It's difficult sometimes to walk that line between giving the patient a quality of life and also doing what we need to do to make sure that the patients we're treating are taking their medications correctly. It's challenging sometimes.
Sure.
I feel like sometimes I've got to say no to patients that I want to say yes to, and that's difficult.
And that's because of certain rules,
Correct.
right?
Yeah,
So
it's just it's safety, it's rules, it's what's best for the patient as well. Sometimes you have to have a little tough love and say,
right.
I'm sorry, no.
Right, but you know what? That's that fine line, and there is a place for it, absolutely. For certain people, like you said, if you shouldn't have to live with it, with chronic pain, and it's not going to go away. You said that your issue is not going to go away.
No, I mean, I have patients that have to choose between going to the grocery store some days or taking a shower because it's too taxing to do both in the same day. And we have a decent amount of patients like that. I mean, I have one patient that travels to me. She takes a shower once a week, and she takes it on the day she comes to see me, and that's it. She lives with her mom. Her mom helps her. She has she has spina bifida, so she's had it since she was a child. I mean, conditions like that, they're not going away.
You see, this is what I love about this show. When you say something like that, it hits someone right in the heart because no one thinks about that. When we talk about opioids and we talk about all of this and we say, oh, there's so many people that are just getting all addicted and it's terrible. But look at that. That person needs that. There's no way that that's going to go away, her condition. And for her, when you say she can only take a shower once a week, that's awful.
It is awful.
Here you are to help them. And there's sometimes you do have to say no, but I think that you said that you're finding ways that you can do as much as you can for your patients.
I mean, there's
So
other
I'm hearing
medications
from
we
you.
can offer those patients as well, There's other treatment modalities that we're going to try to add to our practice that will hopefully help for people that are local. Like I said, we are telemedicine based, but for our local patients, we are going to try to incorporate other treatment modalities for chronic pain so we can just do what we can.
Well, you know what? This is where you can, maybe it's you or someone that that's dealing with someone like this, and we all know someone who's in chronic pain, right? Everybody knows someone who is dealing with some kind of issue. And it could be arthritis. It could be their back has been out, like you said, a slip disc that's been forever. You said neck pain.
So same thing. Same kind of degenerative disc disease in the neck.
There's so many things, and we all know it. So tell them about it. The phone number to call, it's 480-559-3149. It's Phusion with the PH, wellness.com. And they're telemedicine as well. So they can work with anyone in the state. And they're also working on being able to come to local people, which is kind of neat too. What sets you aside from then other pain providers?
I think we listen to patients. I think we're compassionate. We're willing to treat that patient that maybe is stigmatized because they're on high-dose opioids as a person, We do have to have tough conversations with patients like that, but we try to do it with compassion, It's a tough balance sometimes.
I'm sure it is. But I know that when they come to you, your patients probably love you. It's a love-hate relationship.
It is in a
right?
way, yes.
Because
yes.
It's probably got to be. There's sometimes where like you said, you have to say no. But it's good to hear that the people that have ideas about all of this hear that you're saying that. Does that make sense what I'm saying?
Yep, exactly.
Okay, so let me ask you this. What do you think pain patients find most difficult about being on chronic opioid therapy?
I think it's the stigma. I think patients feel judged, because they're taking this pain medication, especially with the climate of today, I think a lot of patients think that people think they're addicted to their medication and that's why they're taking it. I think their chronic pain can be overlooked. And they're also sort of, kind of tied to this bottle, so to speak, in a way. Like, when you go on vacation, you've got to time your office visit for your prescription refill. There's just constraints that come with that I think can be difficult for people. And I think it's also difficult for them to find a provider that's willing to really listen to them.
Well, you talked about what's difficult, so I'm going to ask you, even though it's not on here, what's good? What do they find that they're, that they're happy with then?
I think at our practice, I think that we have a lot of compliments and people say, thank you so much. You've changed my life. You've helped me. I've been looking for a provider that would listen to me. I've been looking for a provider that would give me back my quality of life. I've lost my quality of life and you've given that back. Thank you. How
does it work telemedically when you do that way? How do you work? How does it work?
So we have a HIPAA compliant video, where we chat with the patient. The patient logs in, they wait for us to start the appointment, and then we just have our regular medical appointment. We just talk. How is it going? How's your pain today? Has anything changed? What else are you doing to control your pain, et cetera? Right.
Do you have to find out how they got to it? Does it start from the beginning of what happened in the first place? How did you get there?
So, at the first visit, we do take, a thorough history. We have to establish that it's medically necessary for the patient to be on that medication. And we need to know their medical problems, too. There's medical problems that go along with chronic opioid therapy that we need to be aware of because there's safety issues and things we need to
different medications that they might already be on.
Medications or medical conditions that, affect our care of that patient.
Now, again, the website is Phusion Wellness. It's Phusion, so it's with a PH. And their phone number, it's 480-559-3149. They do work telemedically. So that means that they can help anyone in the state. What is going forward with you all? What are your plans going forward with your patients?
So as I mentioned, we're going to try to expand those services. There are some services that can just help the chronic pain patient, like trigger point injections and things like that. Chronic pain patients, male chronic pain patients who are on chronic opioids tend to have low testosterone. So we're exploring treating our low testosterone patients, and kind of getting into that realm. Again, more of just the whole patient.
Having them become a person again,
right, exactly.
Getting back to being normal.
A little bit more of the whole patient.
And when and I want people to understand that the person that's calling you, it's usually that person that is already on this therapy.
Correct.
Or if somebody, I wanted to make sure that they can understand that too, that somebody might be able to call you who knows someone or their significant other. They're listening to this for the first time. Go ahead. About, that somebody else, that anybody that can call you, that that they might have somebody that they're living with right now that is on medication and they don't know how to help them either. They don't know how to take care of them. Maybe, you know what I'm saying? Yeah. I don't know. I'm not sure. I'm asking you to explain to them who's that patient that's going to call you.
So any chronic pain patient can call us.
Right. But there's also people that are living with them.
Oh, the family member.
Right, the family member.
So if the family member, is feeling like their family member isn't having a good quality of life, let's say maybe, and they feel like that there's more room to grow in that aspect, we're happy to help that patient.
So most people that you talk to, that's what they say. My quality of life is zilch.
Well, it's important, the function, quality of life, medical necessity, those are all important factors when it comes to on pain medicine.
And so, again, you can call them direct. Their phone number, it's 480-559-3149. I would say that we'd like to say that you specialize in people who have difficult cases, correct?
I think we do, yeah.
Okay.
I think we're willing to listen to that patient that, is kind of in a bind, so to speak, with what's going on in today's climate.
And when they work with you, you said you had this guy that you were talking to that was addicted to heroin, right? And now it's like within 3 months, and he's pretty much making a turnaround?
Well, it's a lifelong process, It's always a lifelong process, but currently he's doing well, yes.
Oh, that's awesome. And that's what people want to know, too, is how, they want to get better. People just want to feel better, and they want to do it fast. Right? But unfortunately, this is a lifelong process. It could be forever. Like you said, that person that might have a disease, it's not going to go away. And this might be the right path that you need to go down. You can go ahead and give them a call. Their phone number, it's 559-3149. It's phusionwellness.com. Again, they can work with you telemedically, so you can talk to them that way. They're also looking to come to you at some point, if right here in local here in Arizona. What are your final words? I had to go ahead. What are your final words?
Just know that you're not alone, and if you do have chronic pain, that there's someone that's willing to help you.
Again, that phone number, it's 480-559-3149. It's Phusion with a PH, wellness.com.
If a